Welcome to this Friday's Physio Q&A, your chance to ask any questions you have about pain, injury. So please do, as you start to join us live, please do start to ask any questions in the chat at the side. Please do let me know as you are joining if you can hear me loud and clear. I will start to answer as soon as I can hear that you guys can hear me. I will start to answer all the questions that I've been asked in advance. So please do let me know. But before I do, let me introduce myself to those of you watching the playback. My name's Lucy Macdonald. I am a physiotherapist. I've been a physio for 20 years, more than 20 years now, and I run these regular Friday Q&As. I produce regular videos on YouTube. Me and my team at Octopus Clinic do face-to-face treatments in London, and we do virtual consultations all around the world, or anywhere you are. So that's a bit about me, and you can ask any questions that you have on pain, injuries, training. So please do let me know, those of you that are joining live. Oh, excellent, great. First few messages. Sydney, hello Justine. How lovely for you to be joining us. I hope with a glass of wine as you're in Sydney. It's probably the evening. I'm guessing that there might be a risk that you've got a glass of wine in your hand. So welcome. Last week we had someone from South Carolina, USA, which was rather fun. So I'm always quite excited to hear where people are tuning in for. Not that Kent is not very exciting too. So those of you listening from perhaps less exotic places, you are equally welcome. So welcome. Okie doke. I am going to, for those of you joining live at the moment, interesting things are happening with the tech this morning, which is rather confusing. So it's really great to see you. Stephen, great. You can hear me loud and clear. Angela, welcome. Joe, hello before your big dog walk. enjoy. I'm very jealous of anyone that has dogs. And Steve, you've made it. Brilliant. After all these weeks of trying to make it, you've made it. So please, I know you've got some questions, Steve, so please do start typing away, and I'll make sure that I answer the live questions first. And then I've got on my phone here, I've got a load of questions that people have asked in advance, so I'll answer those as well. Depending on how busy we are, I'll try and answer as many of your questions as I can. I'm really sorry about that drilling noise outside. I hope it's not off-putting. Not much I can do about it. Right, first question has come in. Hi, Eve. Hi, Dave. Right. AD, good morning all. Post shin splint, I have no pain running, excellent, but have pain post runs. Taking an average of 2 days rest between runs, how can I relieve the post run irritation? Okay, so that's an awesome question. So shin splints are one of the most common injuries in runners. So it's really good news that you're not having your pain while you're running. Now, that's because I'm going to just jump in with the scary stuff first, the rarer but scarier stuff first. So pain at the front of the shins in runners, we always have to bear in mind that there could be a possibility that there's a stress fracture. So I would recommend anyone who has shin pain to make sure that you do have a consultation. Either get in touch and we can do a video consult, or you can go and see your GP. But it's really important that we get a diagnosis, because as I say, if you do have a stress fracture, so that's when with repetitive impact, the bone becomes injured and can actually develop actual fractures, so breaks in the bone. Now, depending on where it is in your shin, will very much depend on how we manage that kind of thing. So if it's further down on the inner part of the shin, so down towards the ankle, on the inner aspect of the ankle, then you don't have to take quite so much time off, and it's not quite such a severe injury. But if it's further up at the front, then we really do need to get you off your feet ASAP. However, chances are, based on what you've described, that it's probably a muscular issue. If it's sort of coming and going and you're only feeling it after the running, then that's most likely. In which case, what we need to do is we need to work out the biomechanics of why it's happening. So, well, to be honest, even if it's a stress fracture, but that comes later down the line if it's a stress fracture. But if it's just that muscular micro trauma that's occurring afterwards, the first thing I'd look at, and this goes for everyone watching, so all of you who are typing away your injuries, I can see I'm going to have quite a few today, all of you who have injuries, it's really important that you take a step back, and instead of focusing in on that specific part that is injured, you look at your overall training program. So you look at things like, have you recently increased your distance or speed or some element of the load in your running? Have you increased the frequency of your running? Have you been paying enough attention? And if not, if you have suddenly ramped up the load, then just take a step back, reduce, just slightly reduce the amount, the speed at which you're progressing, and you'll find that you're much less likely to get injured, and your minor injuries are likely to recover. So hello everyone, I can see everyone joining, which is lovely. So the other things to look at are the recovery components. So again, anyone who's injured or training for that matter, who's watching this, it's really important that you get those recovery factors in place. So please do go and watch my video. If you go to the website, octopusclinic.com, and you stick in the top recovery or recover, you'll see there's some videos will pop up, and you can go and watch a whole video where I talk about really practical, useful tips that you can put in place to help your body recover. So things like nutritional tips, stress management, sleep, those are the real key elements. And as I say, really nice practical tips that can really help to make some real difference to that recovery. But if we come back to shin splints, and I'm just going to highlight the question here so that those of you who have joined more recently can see what the question was. With shin splints, as I say, hopefully it's just that muscular side of things, and in which case what we need to do is we need to work out why it is that particular part of your shin is being overloaded. Now, with these kind of injuries, there's been lots of research that's been done to look at what could be the contributing factors, and interestingly, it's more about the strength of your calf muscles rather than the length of your calf muscles. So if you go onto various different if you look at various different YouTube videos and things, you'll see lots of people advocating stretching your calf muscles, but we actually know that doing strength work for your calf muscles, and particularly one of your calf muscles, which is called your soleus, which is the one that attaches below your knee and is super important, takes a hell of a lot of load in running. We know that one, you need to strengthen that one. So the way to do that, if you go to the website and you have a look at the heel drops of the step, the reason I say go to the website rather than just kind of doing a DIY job is that it really helps to get the alignment right. So it's really helpful on the website, I go through it in a huge amount of detail, talking about how to have your ankles in the right position in front of the mirror, etc. So it really does make a difference. So do your heel drops off the step, but with your knees slightly bent, because that will target your soleus more than the other big muscle called your gastrocnemius. But also looking at your foot posture. So having a look and seeing if you've got a particularly stiff foot, and in which case maybe we need to do some work on allowing you to get some movement and some mobility in that foot, a bit more flexibility, if you will. Or have you got a very flat foot that just needs a bit of work to work those muscles inside the foot, the intrinsic muscles, and help maintain a decent foot posture. And again, there's exercises on the website that you can do that, but please do make sure you get a proper diagnosis. Then, like with anything, but particularly I think with shin splints, because there is a huge amount of this excess load that causes the problem, it's really important to take a step back and maybe do a bit more of that strength and conditioning. So all runners, I would recommend you do a couple of sessions of strength and conditioning a week. Now, you don't have to go and spend hours in the gym, even if the gyms are open, but you don't have to spend hours doing it. You just need to do sort of 15-20 minutes of some nice weighted squats, lunges, that kind of stuff. And that will make all the difference to enabling your muscles, not just your calf muscles, but your quads muscles, your glutes muscles, your core muscles, your hamstrings, all the muscles that are involved with running, to help them bear the load that you put through your body when you're running. So there's a video, I put together a video called The Best Exercises for Runners. So any runners watching this, I know there's lots of you, please do go and check out that video. So the two that I always recommend that runners watch, the absolute essentials, are how to optimize your body's recovery and the best exercise for runners. Those two are the biggest, most important things in terms of preventing and treating injuries. So, okay, right. I hope that's answered your question nice and thoroughly, and no doubt there's plenty of people on here who have shin splints as well. If you have any questions as I'm going on, please do if you want me to clarify anything. I know I sort of talk rather quickly, and there's a risk with this coffee in hand that I might get quicker. So do let me know if you want me to clarify anything. Good to see you, Leanne. Oh, Cardiff, Cassia in Cardiff, fabulous. Right, Steve, okie doke. So I'm going to answer your question now. So I've had recurring lower back pain for 30 years. I've seen 3 physios and they've recommended static stretches, which have not helped. I'm going back to the gym on Monday. Any advice would be very welcome. Yes, well, I'm really glad that you're going back to the gym is the first thing, because with recurrent low back pain, we know, or back pain in general, we know that the two really most important things are exercise and sleep. Now that sounds terribly simplistic, and but it can't be underestimated. So often when I see people, so they often come to me in the similar situation that you've just described, having seen different physios, osteopaths, chiropractors in the past, and the pain still come back. Often the times that correlate with the increase in pain is if people have been going through a stressful time and are sleeping less, and or have reduced their exercise levels and then suddenly gone back to it. So it's great that you're coming to get some advice now, because it's going to be really, really important, depending on how much exercise that you've been doing, that you build up your exercise slowly. One of the things that happened this week is that the NICE guidelines, the National Institute for Clinical Excellence, I think is what it's called, came out, and there was yet again the advice for people with chronic pain. Chronic just means people have had it for a long time. So was exercise. And I always think it's a little bit of an unfair thing to say to people who've had pain for a long time, oh, go and exercise. Because often it's the thing that they've been trying to do and are desperately trying to do, but can't do it because of pain. And really, when it comes to exercise for low back pain, what you've got to do is you've got to work out what are the activities, and this is absolutely key. And this is the same with any of you who have injuries, irrespective of whether it's low back pain or anything else. The absolute key to full, thorough recovery is to work out all the different elements of your life that you feel the pain. Okay, so if you've had pain on and off for 30 years, then there's going to be a lot on that list, but it's important to get that full list written down. So, for example, it might be sitting for long periods, standing for long periods, going for walks, etc., lifting things, classic kind of back pain related things. Now, once you've written that list, and then you can score them out of 10, and I've actually done a video on this, but it's part of what I do in all of my initial sessions. If any of my patients who I've seen in the past or currently are watching this, you'll know I then get you to score them all out of 10. That's really important, because then we know we can see, or I can start to envisage the steps that we need to make to take you from, for argument's sake, 2 out of 10 to 10 out of 10 over the next 6 to 12 months. If you've had pain for 30 years, you will need a course of progressive strengthening exercises over a course of at least 6 months to a year. You won't need to see a physio every week, by no means, because the majority of the treatment is all about what you're doing, is all about your exercises, but it's all about treating the not just the biomechanical weaknesses that are inevitably going on as a result of that pain, but also the pain itself. So the pain itself becomes the thing that we are treating. And there's all sorts of tricks that you can use to reduce those pain levels slowly but surely. And I won't start launching into all my pain metaphors at this point on a Friday morning. Yeah, my advice to you would be, get all those things written down, and then with each activity, build each one in small increments. Be very scientific about it, in that only ever increase one variable, so that you always know if there is a flare up, because inevitably in the process there's a flare up. And recently I did what do you call it, an infographic on recovery ups and downs. But there will be ups and downs, but in order to make sure that those downs only last, a couple of days, and therefore don't hold you back or make a big difference to your recovery long term, you just have to be, as I say, painstakingly scientific about it. Steve, I hope that's answered that question. But if you do have other questions, I know you're watching live, so please do continue to pull up on any of the bits that I've mentioned so far. Okay. Next question from Ben. Good morning. What are the best exercises for tight hamstrings? Got today, they got tight at about 4K. I'm not sure what your history is, Ben, in terms of whether you've had hamstring injuries in the past, but hamstrings are a really, really classic one, a bit like calves. So particularly in runners, calf muscles, hamstring muscles are super, super common to become repetitively damaged. And I think that's because often they're overlooked in terms of strengthening, and particularly in what we call the eccentric component, which is like the deceleration component of the muscle. So I would recommend making sure that your strength and conditioning program, which I mentioned at the beginning, you should be doing a couple of times a week, just a little short one, twice a week, should include things like modified deadlifts, or exercise that we call the waiter's bow, which is on the website. So just make sure that you're making sure you're strengthening those hamstrings. And when you're particularly increasing your speed, because if you're a really steady runner, you use your hamstrings far, far less than when you increase your speed. So it's really common. I see hamstring issues coming up more when people start to try and increase their speed. So perhaps they go and they start to do interval training, or some kind of run walk type training, which means that the running component of their training becomes faster, and that's when their hamstrings start to become overloaded. So just if you are starting to increase speed, then make sure that you look at that. Also, and I'm super hesitant to say this, because you should definitely only do this under the guidance of a physio or a coach, is changing your stance length can make a bit of a difference. So but really, it sounds to me like you need to also look at that overall program that I've already talked about. So looking at your frequency of runs, etc. Have you ramped things up too quickly of late, and are you focusing on your recovery? So the other thing with hamstrings is your sciatic nerve, and I'm not saying that it's your sciatic nerve, it's much more likely to be your hamstring, but your sciatic nerve runs right down through your hamstring. So sometimes people come to see me and they just don't understand why their hamstring problem's not going away, and it transpires that there's a component of the sciatic nerve, and therefore we need to treat that with slightly different exercises and in a slightly different way. And then last but not least, highly unlikely but possible, if you have pain in the hamstring, particularly right up in the buttock, then it's worth bearing in mind that it can be referring from the hip, and it could be a stress fracture. But if you're only getting it and it's only tightness at 4K, I really don't think that's the case. But yeah, let me know if you've done that eccentric strengthening component and modified your running. Please do let me know. I'd be happy to see you for a video consultation. If any of you are not sure, when I say video consultation, you're like, what? How can a physio do consultations by video? I've basically been doing 90% of that. 90% of my work has been that over the last year, and they work really, really well. What I do is look at the way you move, take your history, give you a diagnosis, and then send you some exercises and advice around your training program, specific exercises to sort out your biomechanics, alignment, that kind of thing. So it means that you then go and do the things that make you better, which is obviously a lot more sustainable than me just jumping in and sort of doing hands-on, but not to underestimate that either. So yeah, let me know. Okay, next question. Golly gumdrops, we do have a lot today. Hello, Nigel. Okay. What are my thoughts? Oh, this is a lovely question. Good morning. What are your thoughts on the use of neoprene knee supports for osteoarthritis? I have mixed messages. Yeah, this is a classic one. Mixed messages, there's normally an element of truth in all the different messages from my experience. So neoprene knee supports for osteoarthritis. So neoprene, to state the glaringly obvious, doesn't provide structural support for the knee. So if you have like a ligament damage or something like that, you're not going to actually reduce, it's a plastic model of the knee, you're not going to reduce the movement in the knee. However, what it does do is it can provide some sensory feedback. So something we call proprioception, which is your body's positional sense, which in the presence of pain can be reduced. So putting on, it's the same with taping. If you put the neoprene support on the knee, it can really help that sensory feedback, and therefore help the function of the knee, because you're more likely to use your knee and your muscles normally. So I'm a big fan of neoprene knee supports for osteoarthritis or any kind of knee pain, as long as they are comfortable. And that's the absolute key. You really don't have to spend a huge amount of money, and I certainly wouldn't bother with metal hinges down the side. They're not going to do anything. It's all about getting a really well fitted, really comfortable support, and this is the same if anyone's watching with elbow, ankle, you name it. So bear that in mind. And also it keeps the knee warm, and as anyone will know with any kind of joint issues, if you keep your joints warm, they're less painful. If they're less painful, you can use them more, you can keep them really healthy. We know that the best thing that you can do for arthritis is exercise, but again, with the caveats that I gave earlier on, which are that you need to be doing them with the right alignment and with the right incremental increases in load. Otherwise, all that happens is someone's told, oh, exercise is good for osteoarthritis, and they go out and, I don't know, knock off 30 squats, and ouch, big inflammatory response, everything's painful. I recently did whereas if they spent a bit longer building to that stage, then the knee would respond really positively, become stronger, and long term the process of osteoarthritis would not worsen. I recently did a video on knee osteoarthritis. I'm going to do one on hip osteoarthritis soon. The one that I did with a knee is with a patient of mine who was in a situation where she could hardly walk up the stairs, was told that she just had to wait for her total knee replacement on the NHS, and now she's back to running around her garden without pain. So yeah, the term osteoarthritis often comes with all sorts of stigma, and often unnecessarily so. So thanks for asking that question, Nigel. That's great. Yesterday I posted a question. Excellent. Yes, Stephen, you are on my phone of I just haven't got around to anywhere close to answering my requested questions. So I will answer, Stephen, your question now. My right hamstring, oh, you said you posted it yesterday. Okay, and then let me just get the details. So here we go. Here was your question. I have a sore right hamstring that I have been managing for months, and wondered if there's anything to do with my right foot tending to turn out slightly when running. My Garmin also says I have an imbalance with more contact time on my right foot than my left, so I didn't know if that plays a part. Is there anything you can recommend to straighten my duck foot and hopefully help my hamstring? So, and you didn't think you were going to make it, so it's awesome that you've made it today. Brilliant. I'm not sure if you watched the beginning of this, but I did answer a question about hamstrings. So if you've had it for a number of months, I definitely would get it checked out. So I would be really happy to do a video consult with you. So either me or one of my team, if you email reception@octopusclinic.com, then we can get it checked out, because it's just, we need to address the cause of what's going on. There might be a component of, there might be a sciatic component there, but there'll certainly be some weaknesses going on. In terms of the foot being turned out, yes, that can be a sign of a weakness. This may sound a bit weird, but a weakness in the side of the hip, it's often associated with that. So if people have a foot that's particularly turned out, the gluteus medius muscle is often a bit weak. So if you go on the website and you look at the wall ball series, that is really fabulous for working those muscles on the outer aspect of the glute. And this is for anyone else that's watching who has knee issues or isn't able to maintain their knee, foot, hip alignment. It's just a brilliant exercise. It's hard, but it's a brilliant exercise. So the wall ball series, so check that one out, and that will help you to work those muscles. I wouldn't actively try and change your foot placement when you're actually running. If you do that, what happens is you end up with unfortunate compensations, which may actually cause you more harm than good. So I wouldn't advise you to do that, but do go and do that one, and also do the running man. So I can't believe I'm half an hour in and haven't mentioned the running man exercise yet. For those of you that have joined me in the past, it's my favourite running exercise. So go and check out running man. If you, on the website at the top, for those of you that haven't been on there before, there's a search tool, and if you just stick in the words in the search tool, it goes bing, and there it is. There you'll see it. Back to your question about hamstring. So yes, you might, the reason that might be related to your hamstring is because if those muscles on the outer part of your hip are not strong enough, then your body will find other ways of trying to stabilize around your hip, and might well be using your hamstring muscles as stabilizers. So I would work your glutes muscles, as in your glute max, so the muscles at the back of your buttocks, as well as the gluteus medius, the stability muscles around the side of the pelvis, and then potentially, as I say, under the guidance of a physio, I would look at potentially changing your running technique a bit, so particularly your stance length. But yeah, please do come and have a one-to-one session. I think that'd be really important. Okay, next question. I keep getting pain in the right side of my ankle, my right knee, and my right hip. So I'm not sure, Nikki, if you could just give me a bit more info. I'm not sure if you are getting it when you're running, after running, or when you're getting it. But what I would advise with this is that if you're getting pain on the ankle, the knee, and the hip, they're not necessarily all linked. And they could be separate injuries, but there's a much higher chance that they are linked, and possibly it's a referral. So joints refer downwards. So it could be a referred pain coming from your back or your hip. Those would be two things that I would want to look at pretty straight up, and to look at, first of all, what structure's causing that pain. As I say, either what joint or structure in your back or your hips causing it, and then how we can change your biomechanics. So with this kind of thing, I would be looking at the position of your pelvis, the position of your knee, your hip, what muscles are weak, how you're placing your legs when you're walking or running. What are the things that are going back right to the beginning of this session? What are the things that are causing the pain? So are you sitting for long periods, and is that when the pain is becoming aggravated, and in which case do we need to look at making some alterations in the way that you sit, maybe alternating sit to stand, alternating different positions so that you're not holding prolonged positions, because the body just doesn't like prolonged positions. or the mind for that matter, and looking at all those, breaking it down into all those different components, and then giving you exercises accordingly. So making sure that we're working the joints through the ranges that might be weak or less resilient in order to build resilience and strength in those areas. So hopefully that's answered your question, but do give me a bit more info if possible. Right, next question. In fact, I've just seen that you've asked another one further down. And then, yeah, okay. Oh, great. Yes, you've given me a bit more info on this one. So they don't hurt when I'm doing strength training or cardio classes, just when I run and after running. It's very strange. It's not strange in that they are very different activities. It's great news that you're not getting anything occurring when you're doing other activities. It sounds to me like I need to look at the way that you're running. But it sounds like you're doing some nice strength conditioning or cardio classes. So you've got that covered, which is fabulous. It's probably just a matter of making a few tweaks and then hopefully and bridging the gap between what you're doing with your strength conditioning cardio stuff and with your running, and just working out what that bridge is, building it and allowing you to run over it. So yeah, do get in touch, Nikki, please. Right, next one is my hips begin to ache from the 8-mile mark. What can I do to help this? I'm 14 stone but lost 4.5 and no weight is a factor. Congratulations on losing that weight. That is awesome. I exercise 5 times a week and have done so for the past 2 years. I'm 51 and no age is against me. Oh, I can't stop at that point. No, it isn't. 51 is young. And in fact, on that note, I'm not just being, I'm being totally serious, basically. I'm being entirely sincere in that a lot of the fittest people I've come across have been in their 70s, partly because they're retired. They therefore have lots of time to really look after themselves, get themselves strong, do all the right things. They've got the wisdom of the years, so they listen to their bodies, and so yeah, there are lots of people who are in their 60s and 70s who no doubt are probably involved today. So please do chip in if you are one of those people. I know people that run marathons in their, as I say, 60s, 70s. So yeah, age isn't a thing. I mean, it is a thing. The reason it's a thing is that as we get older, our recovery times are slower. But apart from that, it's not a thing. And I'm desperate to do half marathons. Do I just need to keep doing the distance to get used to it, or do I need to strengthen them in some way? I often find it leads to pain in the knee on the inner side. Yes, so definitely you need to do something. You need to change something here. So the only thing with heavier people, and one of the things that drives me absolutely nuts is people being told that they shouldn't be running or shouldn't be doing things because of their weight. It honestly riles me. So I think it's brilliant. Do continue with your running, and I would positively encourage that. If you're heavier, what you do need to make sure is that you're building your distances slower, because if you think about it, you're increasing your load in larger percentages. Oh, I've questioned that, what I've just said. Anyway, but just do it nice and slowly and nice and steadily. So just when you're looking at your training, I exercise 5 times a week. So when you're looking at your training, just make sure, because you're exercising so regularly, just make sure that you are working into your program recovery. So one of the things that is really, really helpful, and loads of you, no doubt, who are watching this, this would really benefit you. So when you're writing your training program, actually write down other elements, not just your running or your exercise. Make sure you also write down a column for nutrition, a column for stress management, a column for sleep. Those things are super, super important. And particularly the stress management and sleep side of things, because not only from a physical recovery perspective. So if you are sleeping really well, that's when your body really, really optimizes its recovery. But also stress can reduce that recovery process. But also from a mental perspective, if you're in a really good place mentally, then you're much more likely to make positive decisions over your activity level. So you're more likely, as I'm sure you're aware, if you're in a good place mentally, you're more likely to have the motivation to do some exercise, but also you're less likely to make bad decisions around like overdoing things. You know, when we're tired, we're emotional, we make decisions that can damage us. So take that, everyone who's watching this, not just this case, but everyone who's watching this, do really bear that in mind. It's definitely a running theme that I see with people that are injured. So, and particularly after the year that we've had, I think a lot of people are struggling with that side of things. So if you do need support, chat to a friend, speak to a loved one, and obviously if you are struggling from a mental health perspective, then do make sure that you go and see your GP, and they can point you in the right direction for professional support. Anyway, we digress. So back onto the hip pain. Now you have to be really careful with hip pain, because hips are one of the areas, like I mentioned at the beginning, with the shins, so pain at the front of the shins. With the hips, it's really another area that unfortunately I see. I've seen a handful of missed hip fractures, where people have been advised, unfortunately, sometimes to run through pain, and it's transpired that they've had a hip fracture. Now, it's really important that you do get any kind of hip pain, if you're a runner, assessed for that reason, because hip fractures can be limb or actually even life-threatening because of the secondary complications if they do occur. They're incredibly rare, but not something to be ignored. So it's most likely that what you're describing, Angela, is more to do with the level of load in your training program. So I would pull back a little bit from the running. Don't stop, but pull back a little bit with the running and increase the amount of strength and conditioning you're doing. So not sure if you've been with us from the beginning, but I would suggest that you make sure you do 2 sessions of strength and conditioning a week, that should involve all the main muscle groups of the body, so the quads, the glutes, the calf muscles, the muscles on the outer parts of the glutes, the core muscles. And do go and check out that video, the best exercises for runners. So if you go to the website, stick in best exercises runners, bing, it'll come up, and I demonstrate all of them. So go and check that one out. Let me have another little look, check I've answered that question. Yeah, hopefully, Angela, that's answered your question. So please do let me know if you have anything else along the way, but do just get in touch. I know I haven't had this week caption on for a while, so that's the details. If you want to get in touch for video consults, please do get in touch. Okie doke. Next question. Oh, good. I'm glad you found that useful, AD. Or Addy. AD must be. Anyway, okay, next one. Andrew, good morning. Bizarrely, I get shoulder pain on the one side post-run. Unsure if this is a strength workout injury and running aggravates it. Stopped the strength workouts a couple of months ago, but continue to run 3 times a week. I try to stretch in the area warm up before. Any other tips? So first of all, I'm going to work backwards. Basically, don't stretch before you run. I would advise, yes, absolutely brilliant that you warm up, so that's great, but I would avoid static stretching. Perhaps you mean dynamic stretching, in which case that's great, but I would advise you against doing static stretches. So don't do kind of sustained stretches like this or this, all those kind of sustained stretches. And that goes for for your legs too. So anyone who's watching this, this goes for everyone. Please don't do sustained stretches before you go for a run or do any kind of exercise. The reason being is that for, I think it's about an hour or so after you've done sustained stretches, the muscles, the level at which the muscle contracts increases. So in other words, you need to put in more effort to get the muscle to contract, which is not what you want to do just before you do exercise. You want the muscles to be ready to go and all excitable and ready to work for you. So you don't want to be slowing down those muscles before you go for your exercise. So do your static stretches at the end by all means, but not before and not during. So back onto the shoulder. You say bizarrely you get shoulder pain, but it's not that uncommon. And I have actually recently done a video on shoulder pain in runners for that very reason. Now, shoulder pain is often because of the nature, I was going to pick up my neck and my shoulder, but because of the nature of, these are plastic, for those of you that are squeamish. Actually, I can't really show you both at the same time. Because of the nature of the neck and the shoulder, often when people talk about shoulder pain, it's actually being referred from either their neck or the top part of their back. So they might feel it in the shoulder blade area, but actually, as I say, it's being referred from the joints at the sort of top and the bottom of the neck and the upper back. And that area sometimes, particularly with longer distance running, or if we're tired, or if we've been sitting at a desk all day, unfortunately, that part of the body can end up, as I'm sure we can all recognise, can end up in that sort of position. And in that sort of position, there's a lot more compression through this part of the neck. And then if you add some kind of impact and jiggliness to it, then that can create issues in those joints and structures at the base of the neck and the top of the back. So, which can then send pain into the shoulder. But of course, you can also get issues with the shoulder too. The most important thing to do is to look at strengthening the muscles of the upper back, neck and shoulder. Now, I'm reticent to advise on exercises for this, because if you get them wrong, it can flare things up. But you do need to be doing things like, so easy things to do that are highly unlikely to flare you up would be the more stretches type of thing, or the mobility stuff. So just gentle stretches of your neck from side to side, chair twists, which again are on the website. But really, to make the actual difference, you need to be doing things where you strengthen your neck and your shoulders, and you're working against resistance to improve the strength of those extensor muscles, as we call them, in the neck and the shoulder, and working on shoulder stability muscles, but in the range of motion that you need for running. So you're able to see some exercises on there, but just be a little bit careful, because if it is coming from your neck or your upper back, then you will find that it'll be a bit more irritable. So I prefer to see you for a video consultation, so that then I can make sure that you're getting the exercises right, that you're targeting the correct muscles, and then you can get rid of that pain. Because if it's been hanging around for a while, I really do strongly suggest that even if you don't come and see me, that you check in with your GP. Again, if there's any kind of pain in that particularly that area around the sort of thorax, I would recommend that you get it checked out if it's just not going away. As I say, it's highly likely to be due to weakness in the muscles that we can sort out with physio. So if you can just come and have a couple of sessions with us, then that'll be ace. Hello, Catherine Ashmore and Claire Henson Bowen. How lovely to see you, fabulous human beings. Okay, cool. Next question. I have a sore Achilles tendon. Common sense would be to rest, but I have a running streak of 830 days. Amazing. I have some kinesiology tape and wondered what the best way of strapping it would be. So I will. Oh, do you know what? I have got a little video on Achilles tendinopathy that I did recently. So this might give you a bit of an insight into the treatment of Achilles tendinopathy. Now, it's tendinopathy, not tendinitis, because we know it's a non-inflammatory thing. Because you've been running for quite so long, one of the most important things with an Achilles tendinopathy is not to miss other things that are going on. So particularly with people that are doing kind of ultra marathon, I don't know what sort of distances you're doing, but particularly people who are doing sort of regular marathons or ultra marathons, we need to be careful of something called compartment syndrome, because that is a rare but dangerous condition. So we need to just have that in our minds, and also to make sure that, sorry, I'll just put this one up so it makes a bit more sense. And to make sure that we're not missing anything else, like if there's a little tendon called your plantaris, so that it's not that, or that there are other referred pains coming from elsewhere, or pain coming from the ankle joint, that sort of thing. So it's very easy to kind of always just zoom in on the main thing in that area. But as you can tell, if I show you the bones of the ankle, your Achilles tendon runs right over the back of the ankle joint there. So and then, as I say, you've got other structures whizzing around the area. So it's really important that we get a diagnosis, and especially if you're planning on continuing to run every day, which you obviously are, please do get in touch and let's do a consult, because the advice to you is going to be a bit different to the advice that I would give most people, which is in this groovy video. Ready? Okay, yes, I was dancing. I hope you like that. Feedback, please. My new love of making little videos. So as you can see from that video, I would normally advise, if you have got an actual diagnosis of Achilles tendinopathy, that you do a loading program, but that's not appropriate for you whilst you're, depending on, as I say, what distances you're doing and things, we'd need to modify and be very cautious, because obviously we don't want to overload it even more. What I would want to do is maybe tweak the way that you're running, maybe change a few bits and bobs to make sure that you're reducing the strain through that Achilles. Taping may well work, and I can't really demonstrate it on right here because I don't have someone's foot that I can show you how to strap up. But really, with K-tape, it's if you, I'm going to try and describe this, but if you stick the piece on the bottom of the heel, make sure it's firmly under, make sure obviously there's no bits sticking out, because the last thing you need at this stage is a load of blisters. And so you get the whole piece of the K-tape. I've got some over there, and then you cut it down the middle. Normally they have this kind of thing on the packet of the K-tape, but anyway, if you cut it into two pieces, the easiest way of doing it is I'm just going to get it. Hang on, 1 second. Right, so you get, oh, goodness me. Right, sorry about that. Right, so you get your K-tape, and if you curve the ends, just because it means that you're less likely to, I don't have scissors on me, but just because you're less likely to, for it to nick the skin. So, and then from about here, you make a cut in the K-tape so that it runs up the middle there, and then you split those two bits and you run them either side, so that you're kind of what's the word? You're kind of hugging the tendon all the way up. That's not a bad way of doing it for starters. You want to, when you put the tape on, you want it to be not on stretch when you first put it on, and then either side of the tendon I would have it under stretch, and then reduce the stretch so that it's no longer under stretch when it sticks up on the muscles either side. But yeah, happy to have a session and I can show you how to do that. I think it'd be good to see you anyway, David, so please do get in touch. Here is the contact details for you. Right. next question. That's a pleasure, Nikki. I ran last week with niggling in the right knee, 5 kilometres. Kept running, had been out 2 days in a row after I couldn't put weight on the leg, resting it since, and prescribed anti-inflammatories. Walked yesterday, tightness there, felt particularly walking in sand, probably not stretching properly. Do circuit training and Pilates too. Don't worry too much about the stretching. It's probably more to do with the fact that, as you say, it doesn't sound like you normally run 2 days in a row. So it sounds like you've just really increased the amount of load. So in the time that your knee would normally be running from your 5K, you've gone and done another run. So that's just added cumulative load. And as a result, you've become injured. Now, there's a number of different causes of knee pain in runners. And actually, I have another groovy graphic to show you on it in a second. But basically, you haven't mentioned sort of where the pain is or anything like that. But the fact that it's been quite so sore, the most common areas of pain, of knee pain in runners, are the kneecap, which can the pain can kind of move around a bit around the kneecap. Also down the outside of the knee, the ITB. But of course, there are a million other structures that could be irritated. The fat pads at the front, either side of the tendon, the patella tendon itself, the quads tendon, and then of course inside the knee. If I open it up, try not to break the anterior and posterior ligaments. You've got these weirdly blue things. They're not blue in your body, just for clarity. They are meniscus. Then you've got cartilage that covers the bone here, and as I say, you've got your ligaments inside. Then you've got fluid. You've got your synovial membrane, etc. And then of course you've got muscles that run down the front and muscles that run down the back with the associated tendons. So it could be, from a structural perspective, a million different things. The fact that it's on uneven surfaces just reflects the fact that when you're walking in sand, it's an uneven surface, there's more forces going through the knee because of the multiplanar, so the rotation and the wibbling that happens when you're walking on sand. Oh, it takes me back to when I decided to go for a massive run on sand once. Bad idea. Anyway, it's a great idea, but just build it up slowly, like anything else. What to advise in your case? It sounds like, if you said you were prescribed anti-inflammatory, it sounds like you possibly saw your GP, which is great. So they will have ruled out anything nasty, and the fact that it's recovering nice and steadily is great. In terms of recovery, I would look more at doing gentle strength and alignment work. So go onto the website, have a look at mini squats as a starting point, and then build up from there. But it would be a pleasure to see you, Karen, for a video consult, either with me or my team, and we can get you on track with the right exercises. So please do get in touch. My pleasure, Ben. I'm glad it was helpful. And Angela, likewise. Sleep and stress are definitely issues. Yeah, they are. And it's funny when I'm talking to patients and I ask them those things, like, you can almost hear a penny dropping. And then of course, with recovery, there's no point me just banging on and on about the sort of physical side of things unless you address those other sleep and stress things, which are more difficult or less straightforward to address, but they are super important. If you don't address the thing that's contributed to the cause of the injury, then of course the injury isn't going to recover long term. So yeah. Here's a nice succinct question from Paddy. How often should you rest? Well, how often should you rest? That's quite a big question. I'm going to try and answer it. It very much depends on what you mean by rest. Or what you're resting from. So to start with the most obvious answer, which is not what you're asking, I know, but you should rest every night for 8 hours with your eyes closed, with your conscious mind switched off, i.e. you should sleep for 8 hours every night. We all need 8 hours sleep every night. We don't get it, and that's why we struggle or one of the reasons that we struggle in many ways. So that should be your first port of call when you're thinking about rest is that, are you getting that? Now, in terms of rest from running, which I think is probably the actual question that you're asking me, you don't have to rest from running. You can run every day. There are plenty of people who run every day and have no problems at all. So there's the answer to that. Having said that, if you're currently running 2 days a week, don't suddenly take what I've just said as me asking you to go running every day. You need to build up in small increments. If you don't build up in small increments, you are massively increasing your chances of injury. And I would look at your running as like a whole week, and I would say only ever increase your running or only ever increase your load by 10%. So that means either your speed, either your distance, either your time, either hills, etc. So only ever build one thing up. So if you are wanting to run more frequently, I had a patient literally this week who said, oh, I'm going to add another run because now my running group is back, which is awesome. So I'm just going to add another run into my week. And I didn't say, but I'm sure if she was watching, she would know that I did the professional equivalent of that, was, perhaps. And so I advised her to reduce down the 2 runs that she was already doing, introduce the 3rd run, and then slowly increase the either one of the other 2 runs back up to the previous level, so that you're not increasing your overall weekly runs by more than about 10%. Now, if you're under the guidance of a physio or a coach, then you may well be advised to increase in larger percentages, and that's fine. But the sort of general sort of rule of thumb, if we go for that 10%, that's a nice safe amount. And also consider all other elements of what you're doing too. So if, for example, you've got a job where you're on your feet and you're lifting and carrying things all day, you need to take that into consideration. And sometimes I know people don't do that. Just making sure that you're working that into your plan. Now, in terms of rest with strength and conditioning, it's really important that if you're working your muscles to fatigue, so if you're actually getting a bit of DOM, so delayed onset muscle soreness, after you've been doing your training, then great, as long as it lasts sort of 72 hours, because the recovery process can take that 72 hours. So I would recommend that after you've done your strength and conditioning, presuming that you're doing it to fatigue, then you rest from strength and conditioning those same muscle groups for 2 whole days. But there are plenty of people that go to the gym or do their strength and conditioning every day, but they just work different muscle groups to fatigue. So it's all about what kind of activity you're doing. Most people, I would say, respond best to having a day or 2 of rest from exercise a week. However, I know there'll be some people watching this who'll be like, no way, I can't do without my exercise fix for the day. So fair enough, awesome. Exercise is really, really good for you. There's no reason why you do have to. I think maybe there's more of a sort of motivational thing, that actually sometimes it's just nice to have a kind of, to sort of have a break, or just a motivation reset. So hopefully that's answered your question, Betty, and it's been helpful for other people watching too, because it's an excellent one. Okay, glad it makes perfect sense, David. That's awesome. If you feel, Karen, back to the knee pain in running, if you feel it more upstairs, then I'd be wanting to look more at the structures maybe inside the knee and get to the bottom of that. Sorry about the noise in the background. There's not much I can do about it. There's some drilling going on my street. So, okay, cool. So, right. So the next question's from Bobby. I can sit with hamstring tendinopathy. I've been stretching for over a month and it's still sore to sit. Bobby, I really would, I know you joined me in the last session, but I really would like to have a video consult with you. I feel that I'm kind of getting to the point where I just need to assess you. So please, can I see you? For a start, please, I'm hoping that when you say stretching your hamstring for a hamstring tendinopathy, I'm hoping you don't mean static stretching, and I'm hoping that you mean loading it, because it's really, really important not to stretch a hamstring tendon problem, because it makes it worse, and that could be why it's not recovering. I really think that you need to have a really steady loading program, starting with static loading, and then we build it gradually, slowly but surely. And if it's not responding to that, then we need to look at alternative treatments. So please do get in touch, Bobby. I would really, I sort of feel your pain with this. I know it's incredibly frustrating, but I've seen so many people who've had really stubborn tendinopathy issues, whether it's the hamstring tendinopathy, the gluteus medius, so the kind of bursitis at the side of the hip, the Achilles tendinopathy. I've seen lots of people with in this awful position where you're not able to do the things that you really love, and I've got them better by giving them the right loading exercises that enables the tendon to recover fully. So please get in touch. I know that last session I gave you lots of advice around tendons and looking at the biomechanics and things. So I hope that was helpful, but please don't stretch it. If you could give me some feedback about that while you're watching it. Okay, so good. You're not stretching it. Oh, phew. I can breathe out. But if you're bridging it and you're doing a bridge with a restriction band, that might be something that at some point in your recovery it might be the right thing for you. It doesn't sound like it's the right thing for you at the moment. If it's not recovering steadily, then we need to change how you're loading it. It might be that we need to look at the position that you're loading it. For example, if you're feeling your hamstring tendon when you're sitting on it, we do need to be working that tendon through that range of hip flexion. So we need to be doing hamstring loading carefully in those ranges. Now, it might be that we need to start static in that load and do static stuff through the different ranges of hamstring activity. But it might be that we can add a little bit of movement or different components. It's impossible, obviously, for me to be specific when I haven't assessed you. So if you do want to get in touch, please get in touch with me, reception@octopusclinic.com. And if you just explain in your email that we've had this sort of conversation, online conversation, then they'll be able to get you in, and we can and I can assess you and get you sorted with the right exercises once and for all. Yeah, and all these things, Bobby, that you're talking about, it's a classic hamstring tendinopathy from the sounds of it. So yeah, please do get in touch. Okie doke. Right, my pleasure, Nigel. Anyone else who wants to ask any questions? I think I might need to be wrapping up quite soon. I'm going to just answer the questions that I've been asked in advance, those that I haven't answered already. So if you are still watching and you'd like to ask, if you have any other questions, please do join me next week. If you did ask me questions in advance and you're patiently watching live, I'm going to answer them now. So the next question is, I've got some heel pain since a run on dried craggy mud. Hang on, let me just change the caption. There we go. So I've got some heel pain since a run on dried craggy mud path last week. It's like a semicircle around the back under the heel, but comes up the outer edges of the heel first a couple of times of a run. Any advice? A semicircle around the back under the heel, but comes up to the outer edges of the heel first a couple of times around. Okay, rather than me trying to get the precise point where your pain is, it's often the case. I think I mentioned earlier, I'm not sure if you watched you've watched the whole of this, but if you're on an uneven surface, you obviously get more forces going through the joints, because there's that there are the multiplanar, the lateral and the rotational movements that create a different kind of load. So it might be, I'm not entirely sure whether it's over your over the heel, under the heel. So you say under the heel, but comes at the edges. The reason I'm hesitating and umming and ahhing is that if it's, it could either be, so here's the back of your heel. So this is your calcaneal bone. Your Achilles tendon comes down the back here and inserts into the calcaneus. Likewise, on the underside of the foot, your plantar fascia comes up and then inserts into the heel. So kind of depending on where it is on the heel, how far underneath it is. If it's more underneath, then it's more likely to be your plantar fascia. If it's more at the back of the heel, then it's more likely to be your Achilles tendinopathy. What I would advise you do, Karen, is based on the information that I've just given you, if you go onto the website and you put in Achilles tendinopathy, or just Achilles, just the word Achilles, okay? And I talk through the management of Achilles tendinopathy in that video. Likewise, I have a video for plantar fasciopathy. So if you put in plantar fascia or plantar fasciopathy, you'll get the video will pop up of plantar fascia, or maybe I've even called it foot pain in runners or something like that. So have a look at that, and depending on which one it is, you can take your pick as to the which one's the relevant advice. So please do go and have a look at that. Next question. I've hurt my back. I don't know how. I got up from sitting down and felt a spasm in my back. This was a week ago. The pain is awful. Doctors say painkillers and 6 to 8 weeks off. Any suggestions welcome? It's my lower back. Yes. So first of all, coming right back to what I was talking about at the beginning with back pain, it's super important. So right at the beginning, I responded to someone who had asked me about pain that they've been having in their back for 30 years on and off. The vast majority of back pain that people experience, so something like over 95% of us have back pain at some point in our lives. It goes away, doesn't come back. And the important thing is, and even if it's really, really nasty, severe pain, to know that it is going to recover. But there are two really important things, and those who've watched from the beginning to the end of this rather long session today will know that they are movement and sleep, or rather movement or exercise and sleep. So those are the two things that are really, really important for your back pain to recover properly. Now, if you're in a huge amount of pain, then you might find that you can only do a tiny bit of exercise or a tiny bit of movement. And the more you can do, the more sort of little and often you can do throughout the day, the better. Now, you might find that first thing in the morning you're already stiff. On that note, if you're not sleeping, some painkillers will work on some people better than others. It's really important to go back to your GP and discuss alternative medications if you're unable to sleep at night, because it's really important that you get a decent night's sleep, because that's fundamental in recovery. So those are the two things. First of all, there are multiple different things that could be causing your back pain. And if you go to the website, I've done a whole series of videos on back pain. Obviously, back pain is the most common musculoskeletal complaint. So you're not alone. But as I say, the vast majority, I cannot emphasize enough, the vast majority of back pain will resolve with exercise and decent sleep. So it could be caused, as I say, by a number of different structures. It could be muscular, although it sounds quite severe. So it could also be some of the joints. So you've got these little joints at the side of your back here called your facet joints. It could be the discs in your lower back that are the joints in between. But even if it is one of those things or a combination of those things, as I say, it will recover with movement and sleep and time. So I'd be very happy if you could come and have a consultation with me or my team. I'd be really happy to give you some specific exercises, and we can look at your movement, etc., and get you sorted. So please do get in touch. But remember those fundamentals, and do go onto the website. Put back pain into the website, www.octopusclinic.com, and all sorts of things on back pain will ping up that I think you'll find useful. And on that note, actually, I'm going to just say anyone with back pain, although the pain can be the most concerning thing, actually other symptoms are more important. So I want you to watch this video and check that you don't have any of these symptoms. So are we ready? Some cheesy music, I think, with this one as well, but let's see. Well, that was quick, wasn't it? I'll do it again. I will put that on the website so that you can spend a bit more time looking at it, but it's really important that you just check. So there's a number of different signs that can give us an indication that there might be some nerve damage going on. Highly unlikely, but possible. Just be aware of the signs and the symptoms. But as I say, they're also on, if you type into the website, when is back pain an emergency, that it will I talk through all the different signs of nerve issues. So next one. I have tightness and pain in the top of my calf muscle and then through the back of the knee. Any ideas what this might be and how to loosen it up? So calf muscle and then to the back of the knee. So there is a structure that does pass, that passes up through the calf and through the back of the knee. It's your gastrocnemius muscle. Fabulous word, isn't it? Gastrocnemius. So it's possible that it's that, but I hesitate because there are lots of other things that could be causing it. So, for example, you could be having referred pain from some of the structures inside the knee itself that could be referring down the back of the calf. That's very possible. So I wouldn't automatically jump to it being a calf issue, to be honest. So it would be nice to be able to diagnose what's the cause of the pain, because if it is just a muscular injury, then it's a matter of reeling back your running in order that you can then, not stopping it, but just reducing it back a little bit so that then you can strengthen those muscles. So strengthen your gastrocnemius and soleus muscles in the back of the calf. The gastrocnemius, so with those, I would do, would I do both? Yeah, I'd probably do it with both. I'd probably do strength work, both with your knee slightly bent and your knee fully straight, just to make sure that you're targeting those. And then also to work out why it is that you're getting overload of the muscles in that part of your leg. Maybe if you're watching this, please do come and join me if you can next week. Next week it will be at 9 a.m. again on a Friday. So please do join me then and perhaps give me a little bit more info around that. I would certainly avoid stretching before or during, and I would just stretch afterwards and make sure, if you're not sure how to stretch your calf muscles properly, or any muscles for that matter, it won't surprise you to know that we've got a whole series on stretching on the website. So if you go at the top to the videos section, click on the videos, click on the stretching, you'll get all the stretching that you need on there. So next one. So I think I might have answered this question, but I'm going to read it out anyway. I'm having a few issues with knee pain, particularly on the inside of my knees. It's not too bad yet, but can feel the beginning to twinge. I use K-tape every time I run, but it would be great to hear what stretches would be good to help prevent knee pain. Is there also anything that can help to stretch or help the shins? No issues yet, but not wanting shin splints. So yes, the best thing that you can do is introduce some strength conditioning into your training. It sounds to me like you might just be doing a little bit too much. So I would just reel things back in very slightly. So you're still getting your fabulous endorphins and all the positive health benefits from running, but you just slow it down, as in not your running speed. So just reduce the amount of running that you're doing at the moment. Introduce some strength conditioning twice a week. So go onto the website, put in best exercises for runners. You'll see on there squats, lunges, etc. Running Man. All the good stuff. Do those twice a week, and that will make a really big difference. Stretching, only stretch afterwards, and with shins, all the things I've mentioned earlier. Hopefully you've got a huge amount of information from the stuff that we've talked through already, so I think I've covered most of that. Please do get in touch if I haven't answered any of your questions. Again, best exercises for helping core strength to combat hip niggles before it gets worse when long running. Go to the website, go and look at the wall ball exercise, squats, lunges, deadlifts. Basically look at the exercises, the best exercises for runners, and I think that will help you as well. But please do make sure, if you've kind of fast forwarded through the playback and you're now just watching the end, please do watch the whole of this, because from the beginning I talk through lots of different things that I think would be really helpful for you around recovery, around training programs, etc. So please do watch the whole shebang. And then last but not least, I've not run a huge amount before, but signed up for a half marathon in October. I've been alternating between 5, 7 and 10Ks and have recurring pain in my left leg. And on my run yesterday, both my calves were quite sore. I'd really appreciate some help. I'm not sure how quickly you've got to doing 5, 7 and 10Ks, but hopefully, so if you've watched all of the video, the playback from today, and I think I answer all of those things in the rest of the video already. So I hope that that's been helpful for everyone. Please do come and join next week. Please do invite your friends, family, the more the merrier. It's been an absolute pleasure again today. I wish you all a very enjoyable rest of the Easter school holidays anyway. So I will see you next week. Again, it will be at 9 a.m. And then once the kids go back to school, I'll be reversing back to 1:30 p.m. on Fridays. But it's been a real pleasure. Please do get in touch if you have any issues in the meantime. Yeah, thanks for joining, folks. Bye.